Hello, and welcome to the webinar, Telehealth and Person-Centered Care. My name is Karen Galbraith, and I'm the Training Projects Coordinator with the Pennsylvania Coalition Against Rape. For those of you who may not be familiar with PCAR, we are a statewide coalition that partners with a network of rape crisis centers across Pennsylvania to provide help, hope, and healing to residents of the Commonwealth. I'm very excited today to introduce our presenter. Alicia M. Cheeks is a licensed clinical social worker with over a decade of experience working with adults, children, and families in outpatient, inpatient, mobile service, natural environment, residential treatment, forensic, and private practice settings. She has clinical experience and specialized education in trauma treatment, behavioral issues, family dynamics, and mental health. Both her clinical and personal experiences as an educator, clinician, and community activist have contributed to her specialization in family systems, trauma, including symptomology, trauma-focused intervention, including the sanctuary model, education, and natural setting treatment and assessment. She is especially interested in educating professionals on the many faces of the human experience when influenced by time, culture, and technology in an ever-evolving society. So welcome, Alicia. We're thrilled to have you with us today.
Good morning, everyone. So I have been hearing a ton of questions and getting a ton of questions from providers in regards to how do we manage telehealth? How do we get the services to our clients that they need, connect with our consumers in a manner that is genuine and authentic. And I think for each of us, we found little bits and pieces of nuggets along the way by trial and error. But it is my hope that I am able to provide you all with clarity and just support and understanding how we're able to take that walk with the people that we serve and do so just as well as we've done when we were living in a face-to-face world. So I want to start by saying for the human service professional, trauma is nothing new. This is something that if you work within the human service profession, you probably have come in contact with many individuals that are currently suffering and struggling with symptoms of trauma or have dealt with that in the past. For the last 15 months, however, it's almost as if the world has created this perfect storm. And I say, you know, within my PowerPoint slide, the perfect storm of 2020 and 2021 with the question mark, because as you very well know, we are still continuing to live in this altered sense of normal. For one of the first times in a long time, most, if not all human beings right now are currently experiencing some form of trauma. Now realize that, you know, that trauma can be on various levels. We have some individuals that might be struggling with the illness portion, which is the coronavirus. We have some individuals that might be struggling to deal with the aftermath of our communities, our societies after this pandemic, be it financial, be it seeking employment. So we all are at a point of struggling to figure out how to find a normal. So let's talk about trauma first and foremost. I think that it is human nature for us to attempt to define and box in what a word is or an ideal is, but realize that trauma is a response, right? It also can be an event, but trauma is identified by the individual who has dealt with the experience. So typically the response that we have to the traumatic event is one that is built out of survival. And we are going to get to that in a little bit. So let's talk about some preconditions for trauma. So traumatic situations are going to greatly increase the likelihood that people have, of course, of developing post-traumatic disorder. So in order for us to understand how trauma affects individuals, we probably should talk about some of the themes, some of the experiences that increase the likelihood that someone will experience that post-traumatic distress. So Dr. Bessel van der Kolk, renowned trauma psychiatrist, he is an educator, he is a researcher, reported that there are seven preconditioned themes to trauma. And I just want to talk to you guys just a little bit about them. So the first precondition for trauma would be a lack of predictability. So if you look at our world right now, we have some hints of the world starting to settle down. You have people who are starting to get vaccinated. You have new stores that are starting to open up saying, hey, if you've been vaccinated, come on in without a mask. But let's remember that in the beginning of the pandemic, there was not a lot of consistency, and we did not have a lot of ability to figure out what comes next. And in fact, that was a major cause of why you see a lot of people struggling as much as they are now. Second is immobility. So think about at the beginning of the pandemic, and even let's say 4 or 5 months ago, the world remained closed. Business hours were altered. It was a guessing game on whether or not children would be in school. So we have definitely dealt with when we look at being able to be mobile and do the things that we typically do, there was definitely a halt to that. Loss of connection is going to be a precondition. So when you are on what I call the island of isolation and you don't have those support networks or those connections, it becomes a very dark place at times. And that kind of leads to various other feelings and experiences. Numbing out and spacing out. So I don't know about you guys, but there became a time recently where I wake up on a Wednesday thinking that it was a Monday. So having that difficulty with keeping in touch with what was going on in the world, because my sense of normal had been destroyed. I knew that on Wednesdays, I might go to, a certain workout class, or I might, listen or watch a certain show. And when some of those things stopped happening, it became difficult to figure out where we were within the week. And that goes into loss of sense of time and sequence. Loss of safety, and safety can be physical safety. Safety can be that emotional safety, financial safety, and then loss of sense and purpose. So realize if you have no sense of why you're getting up in the morning, or what your purpose is throughout the day, that becomes very difficult to deal with, day-to-day things. So what type of care best assists human service professionals in meeting the needs of those dealing with trauma today in this moment? So I would say trauma-informed care. Trauma-informed care is going to recognize and consider the nature of the trauma that the individual has experienced. They're going to uphold the environments of healing and recovery that the client or the individual currently operates in, and the systems that need to be built in order to promote that recovery. The goal is for trauma-informed care to not re-traumatize the individual. And again, we go back to the point of trauma is not a one size fits all. What I identify as traumatic for me might be something that another individual may feel was not that big of a deal for them if they experienced it. So that means in order for us to engage in trauma-informed care, we have to understand the individualized factors of trauma. And in order to do that, we actually have to understand the individuals that we work with. So here we have SAMHSA's 4 R's of trauma-informed care. So these 4 R's are going to basically work to build the foundation of any type of care that has those goals and that understanding of understanding the individual and the trauma that they've dealt with. So the first R is going to be realized. So as human service workers dealing with individuals with trauma, We have to understand that trauma is very widespread. In fact, most of us have experienced it or are experiencing it right now. Um, and that, it is a pathway to recovery. It is not a linear experience. You are going to come in contact with individuals that, may meet the goal one day and might not make the goal the next day. The second R is recognize, recognizing what the signs and the symptoms of trauma are. And we're going to go over that in a slide a little later. The third R is learning how to respond to trauma, understanding from a psychoeducational standpoint how to, assist clients in understanding what trauma is, what it looks like, what it feels like, but also understanding what service delivery options are going to be appropriate for that individual, being able to work with the individual so that they're able to choose their care as well. And then the fourth and final R is resist. And that is resisting re-traumatizing the individuals we're working with. That includes attempting to decrease any triggers that might be unnecessary and learning not to punish individuals for their survival skills. So oftentimes you'll see that those behaviors, whether they're maladaptive or whether they are behaviors that are not typically in the quote unquote norm. They are survival skills. And these behaviors serve a purpose and have served a purpose for helping these individuals survive the trauma that they've experienced. Looking over my notes here. Okay. So when we talk about trauma-informed care, there are various models that fall underneath of the trauma-informed care umbrella. And one of those models includes person-centered care. So if we are saying that, trauma is prevalent, if we are saying that trauma is a experience where we have to learn how to understand an individual and their specific trauma, their specific individualized factors in order to help. Person-centered care is the best model that we can use in order to build those connections. So person-centered care is going to be defined. Oh, there we go. Let me go back one more. Perfect, thank you. So person-centered care is defined as providing care that is respectful of the individuals we're working with. It is receptive to individual preferences, the individual's values, what's important to them. And it ensures that these principles of focusing on that individual guides all decisions that are made in regards to their care. So we want to be strength-based. We want to focus on what is positive about the individual, the skills that the individual already possesses. And that can be, that this individual already has a strong support network. That's a positive, that's a strength. We want to focus on the individual's capacity. Not every person is going to go through this journey of recovery the same way. Not every person is going to have a one-size-fits-all treatment plan. So it's important that we pay attention to where the individual is at. And we also want to know what the individual wants to get out of the treatment. That's super important. So an effective person-centered care is going to build up the voice of the individual and help and assist and support them in advocating for themselves and building that resiliency. So, what exactly does person-centered care look like? It sounds good. Of course, I'm pretty sure that each of us and each of you who are participating in this training would love for your providers, each one of them, to put the person first. But what does that look like? So the first thing is, as providers, as human service professionals, we have to be able to check and examine our own assumptions. So realize that assumptions aren't always made out of um, a negative thought process or attempting to um, box someone in. I think a lot of times assumptions are made because within our human brains, it becomes easier to create boxes and categories in order to hold information or understand. But when we assume, we at times can take away the power of choice and more importantly, the power of voice from those that we are seeking to help. So we need to make sure that we understand what our own assumptions and our own conclusions are and what those perspectives are of the people that we were put in place to support and serve. We want to look at choosing our language and our vocabulary wisely. Um, Realize that depending on the individual that you're sitting in front of, you need to be sensitive to what the individual has gone through, what their experiences in life have been, and how you refer to them. I would say we want to be very careful of creating titles or referring to individuals as their diagnosis. Person-centered care, it can be as small as saying, an individual who has a visual impairment versus a blind person. That is giving an individual their respect. This is one part of that individual. But my favorite way of referring to, an individual or client is by their name. And I feel like that is super important. Um, we need to look at changing our expectations and beliefs about people. Realize that once we are looking at the human being that stands before us, the individual that we have been put in place to assist, um, it becomes a lot easier to see the world through that person's eyes versus attempting to generalize what we know of the world, our perspective, and push it on someone else. And that kind of segues into altering attitudes as well, and realizing that all of us as human service professionals are going to come into the profession with some preconceived notions, and realizing that every step of the way we need to be doing a check-in process on those expectations, those attitudes, in order for us to see each one of the individuals we serve as human beings. And then constructing support networks to wrap around those in care. So we need to make sure, regardless of what environment our clients, our participants are engaging in, that we've created that support network that kind of wraps them up and allows them to have access to the services and supports that they need. So we have here a how-to guide, and I just kind of briefly documented some of the tips and that I've utilized and some of the research that I found just based on how we implement person-centered care techniques, person-centered care action steps in order to get to that point where we are solely seeing the individual. So the first thing is how do we get to a point of operating in person-centered care? So the first thing I would say is giving the client or participant, or however you would refer to that individual, full partner status. And when I say full partner status, realize that that client that we are helping needs to always be, if not in the driver's seat, definitely in the passenger seat. I say to human service professionals all the time, you want to work yourself out of a job, right? You want to be able to work with the client so that they have the tools and the support networks that they need, so you're no longer needed. And when you're no longer needed, that client is the one that's carrying the torch, and they're able to advocate for themselves. So the only way that they can get to that point is by having a front row seat in regards to the decisions that are being made. Um, if they do not have that front row seat, it becomes very difficult for an individual to maintain a plan that they weren't a part of creating. Um, we need to show, as human service professionals, we need to show our clients that, you know, their perspectives, their choices as far as what they would like are the core focus of every effort that we make in helping them walk towards recovery. Minimizing what the client likes and what they don't like. And that is not always something that we can do. Realize that when we're dealing with difficult subjects, such as sexual assault, such as, you know, any form of trauma, sometimes you will have a client that is hesitant. Sometimes you will have a client that is, you know, unsure, and at times it could look like resistant, and that is part of the journey. So when we are seeking to understand our clients, we also need to realize that, you know, there will be those time periods where we need to pause for a second. But when we're minimizing what they don't like, it can be something as small as understanding that a client does not operate well in the morning time and making sure that appointments and things that are scheduled happen in the afternoon and the evening. So I don't know about you guys, but I am not completely human until I have at least 2 cups of coffee in me. That's just the story of my life. So if someone were wanting to utilize person-centered care for me, with me as the client, I would graciously appreciate not having meetings or appointments early in the morning before my coffee. And I think that that allows me to at least come to interactions and meetings rationally. So that small change, even for our clients, could be something that allows them to help themselves a little bit more and for us to assist them as well. So seeking to understand the individual. I mean, realize this is what person-centered care is all about. Understand their background, you know, where they come from, how they view the world, what are their interests, what are the things that they're good at. We want to know what are the supports that this person already has in place. And then of course, what are some of those triggers to various emotions, you know, emotions that are positive, emotions that are negative. When we are able to see the world through our clients' eyes, we are able to actually walk beside them in the journey instead of in front of them. So some other suggestions: implementing their preference into treatment planning in their care. So offering flexibility and offering options. So often the clients that, you know, we work with, you know, have a choice as far as providers, have a choice as far as what type of service they would like to do. So being able to provide those types of flexible options um, is typically very good when it comes to person-centered care. So this one is my favorite. Be consistent and be predictable. So when you are dealing with an individual that has, you know, survived or is currently dealing with, you know, a trauma, realize consistency and predictability are some of the best things that you can give that client. I think that consistency helps build trust. And trust is what's necessary in order to deal with individuals who have dealt with trauma in general. Promote choice making opportunities. So if we want a client, a consumer, an individual to be able to make healthy choices in the future on their own, we need to be able to give them opportunities to make choices. And I think also in making choices, understanding that it is okay if a client does not make the choice that we feel is right, right? Because ultimately, if we are actively engaging in centered care, the choice that the client is making is the best choice for the client. And then seeking to understand behavior, even when it's maladaptive. So realize that behavior is communication. And I believe we talk about in the next slide some ways that communication comes across. There we go. Okay. So The way that we behave always serves a purpose. It serves a function. Okay. For a lot of people, especially when we are looking at surviving and trauma, those behaviors typically were either protective factors that kept them safe, right, or factors that kind of hindered the trauma from happening per se. So some actions that we might see in clients that we still feel are problem behaviors or maladaptive could be just that survival, right? So, some possible routes for problematic, challenging, or aggressive actions. So, some roots for those behaviors could be fear and anxiety, right? Maybe it's just stress. So, when we are dealing with all of these themes that have come to the surface with the pandemic, realize that someone wanting to control an aspect of their treatment or someone showing up to a service frustrated, that could simply be a byproduct of fear, anxiety, and stress that they're dealing with. And it's important to get to the root of that. It could be, a person is having a problem communicating what they need. And sometimes individuals struggle with figuring out what they need for themselves, especially under high stress. Think about how many times, within the last year, you felt whether it be low self worth or having no control at all. So when we go through these negative experiences, typically we do not feel like rainbows and sunshine. And realize that as service professionals, it is important that we are able to understand, we are able to recognize that some of the negative or maladaptive behaviors that are identified typically have a higher purpose. So, using person centered language, strength based thinking, and strength based language. So, earlier I talked about the example of um, the person centered language and referring to someone as an individual with a visual impairment versus a blind person. So realize that I think person centered language honestly takes practice, and that's okay. But when you are building connections, when you are building rapport with an individual, I think you are already in a great place to build that respect level with a client and an individual to a place where it's honestly in your heart to put that client and that person first. So that journey becomes a natural one. And then taking the journey with the individual, not for the individual. So again, we want to work our way out of a job. So that means that the whole time that we're working with our clients, with individuals, we are honestly working towards preparing them for the moment when they're doing this themselves. So those talents that they've identified, that we see, that their support see, we need to go ahead and lift those up. We need to emphasize the success that they make and the success that they've had in the past. And we also need to learn that not every error, not every, quote unquote mistake needs to be one that's pushed to the forefront and examined. A lot of times, mistakes turn into lessons. And that is part of the journey of recovery. So it's important that we at times stand back and allow our clients to process even those low times, and then delivering support where it's needed. So the question of the day is, how do we translate person-centered care through the telehealth lens? Okay, so I know at this point you're saying to me, Alicia, this is all well and fine. This is great. I get person-centered care. I am probably doing it already most of the time. Thanks for the facts. But how do I get this to come across the screen? So let's talk about it. The first thing is balance the attention that we are giving to the emotions that the client is experiencing and the content that they are sharing. So when we are actually face to face with the client, it becomes a little bit easier to just pay attention to the words because we are in typically the same room as the client. It is easy to kind of judge voice tone and, the whole body language versus just the square that we're looking at. But online, that is completely different. So online, we need to be paying attention to what's verbalized and what's not verbalized. So if you know that your client typically makes a face when they're not telling the truth or when they're feeling, feelings of shame, it is important that you are paying attention to those things and questioning those things. Um, and sometimes that question just sounds like, hey, it kind of seems like you made a face like you're having a thought about what we just talked about. So we process through that. Am I reading that correctly? So being able to clarify what you're seeing will greatly improve your ability to engage in that service, that interaction with the client online. Um, Set the standard for uninterrupted private communication. So realize that even within a face-to-face appointment, within an office, it would be very difficult if you were trying to talk to someone as a service provider, and someone is constantly knocking on your door, right? So realize that the same is true when we are operating off of video and through telehealth. We need to make sure that the distractions are at a minimum, and that the client is getting our undivided attention. And then focusing on our own volume, our own voice clarity, and where the camera is. So I think one of the most confusing things in the beginning when we were figuring out telehealth was where to look on the camera. So do I attempt to look at the client's face? Do I attempt to look, at the little hole in my camera? Where is it that I'm supposed to be focusing? So being able to understand that balance, and realizing that, yes, I need to be focused on the camera, but it's okay for me to look from time to time at the client's face in order for me to have what I need for that connection and that communication. And then seeking to understand the client's experience with precision. So that's all about the person-centered care that we've been talking about, right? Understanding that lens that the client has and their view on the world. When we are unsure of what their perspective is, let's ask. If we think we know, let's ask again just to make sure. Because the better we know our clients and those individuals, the more, again, we are walking side by side in the experience. So when it comes to therapists, human service professionals, we definitely need to be aware of our own clarity and our own communication when it comes to our clients. So I know for me, and I am going to be completely honest, I speak extremely fast. And at times, I'm wondering how the thought processed as quickly as it did in my brain. So it's important to check in with ourselves and realize that there will be times that, we need to tone it down volume wise. It's important for us to understand when we're speaking fast, and making sure that, in those conversations, we are doing things like, having compassion, showing empathy for our clients. Um, because sometimes those things are missed when you are attempting to find a solution or get the job done. And those are very important markers. Um, so some activities that we can do even through telehealth for ourselves, for our clients, include things like joint breathing exercises. So if we're dealing with clients who are struggling with emotional regulation, um, joint breathing exercises through video allow you to be able to coach that client through, what that breath should look like, what should be happening with their chest and with their stomach. Telehealth is a great way for us to see the natural environment that our clients and the individuals we serve operate in. So things like, grounding techniques for, emotional regulation, and being able to have a client identify what makes them feel safe, and what their favorite part of their environment is, or even what are the things that trigger you in that environment. These are things that we're able to do in telehealth that we were not able to do at the office, or at the doctor's office, or in those physical locations. So another tip that I have is, developing the skill of being able to make the client aware when the client is engaging in or demonstrating strong feelings through video. Um, so I think through video, one of the best tools that we have with the camera is that we get a very close view to the face, and you are able to see different things in an individual's face that would be a little challenging to see face to face because you would have to be very close. So when we are recognizing during our services that an individual is dealing with strong feelings, being able to point them out and help the client process through them is a great tool. Being able to say, I see, within your face that your eyebrows are very scrunched, or, your eyes are super squinty, or the tone of your voice just changed. When we're able to verbalize those observations, we are ultimately passing on a torch for the client to be able to see those observations in themselves, and for them to identify what they're feeling as well to add to those observations. And then lastly on this slide is using plural terms. So when we are discussing with clients different options, different goals and steps, using plural terms like we will work on emotional regulation, or we will work on safety planning, or let's call the doctor's office and see if we can get you an appointment. Being able to use those plural terms honestly is huge, in a sense of, for a person who feels like they are on, again, isolation island, being able to hear the we and the let's maybe brings down that wall just a smidge, where that person doesn't feel as alone and that person feels like they have a partner on the journey. So we've learned a little bit about telehealth. We've learned some about person-centered care. And now the best tool that I can give you is the understanding that you, as a clinician, as a staff member, as a therapist, have to take care of yourself. So here's my self-care requirement piece for you. If you have not already realized, which I'm sure you have, telehealth is exhausting. It can be very rewarding. It can give, the individuals that we serve opportunities that they might not have had in face-to-face sessions, but it requires a lot. And that includes concentration. Realize that at times telehealth is more demanding than face-to-face therapy, in the sense of you are doing more digging, you are compensating more for your lack of ability to be in the same room with an individual. And then let's not forget that those professional and personal boundaries that we've worked super hard to build throughout the years have completely disappeared in some way, shape, or form. And I'll prove it to you. Before, when we were face to face in offices and the world was normal, once we went home, for most of us as professionals, the day stopped. Now, for a lot of us, our day starts and stops at home, looking at a video screen, engaging with clients, engaging with colleagues, reading emails, and everything in between. So self-care, if for a clinician and for a human service professional, is more important than ever. So implementing self-care practices are super important. However, I think it's easier said than done. So I think that it's important for me to just point out some things that we can do on a day-to-day basis that may be a little bit more manageable. So seeking support from colleagues. One of the reasons why this is so helpful as self-care is because more than likely your colleagues are going to understand some of the stressors that you face within the professional realm. And honestly, there's nothing better than not having to explain yourself and someone just getting it. So at times your colleagues are going to be wonderful, wonderful people to talk to, medical professionals and spiritual leaders. I hope that as a human service professional, if we are preaching that therapy and self-care is important to our clients, that we are taking the same advice for ourselves. And that includes, speaking to a psychiatrist if necessary, or a therapist, or a coach. And that also includes our own spiritual leaders if we have them. Engaging in identifying routines. So if we have a routine, realize we are more present and active in the moment. I know for me, a routine helps me separate the Monday through Wednesday and realizing, where we are in the week, which of course is very grounding and healthy. We need to learn how to create boundaries. Yes, the boundaries at times are blurred, but that does not mean that they should be erased. So if you're working from home and you're managing all that comes with that, try setting a new work from home schedule. So maybe that means that, you start a little bit early or you end a little bit early, but having those boundaries in place allows you to engage in the time that you need for self. And then identify when you're stressed. Identify when you're operating as your best self. Because if you don't know when you're stressed, you're going to be stressed for a significantly longer period of time before you recognize that something needs to change. But when you realize what your best self is and what that version is, that's good to identify too, because whatever you're doing to feel that way, keep doing it. And then, just with that self care, understanding, what burnout looks like. And that's important. Burnout is going to look completely different for different people. So, therapist burnout is going to have three components. You have the exhaustion emotionally, where, typically with that exhaustion, there is, less focus or less ability to focus. Maybe we aren't showing as much empathy because emotionally we just don't have any more to give. Then there's the depersonalization portion of it, where maybe we're not able to give that compassion that we typically do because we feel like we're drowning in our own emotions and our own thoughts. And then that diminished sense of accomplishment, that just feeling like it's never good enough. I never feel like I meet the marker. So if you are dealing with any of these three components, it is extremely important to start doing that dig from within and that journey of self, because realize if you are pouring from an empty cup, you're not giving anyone the service that they deserve, and you're not giving yourself the love and the respect that you deserve. So again, there is no specified classification of burned out. It will look different for each individual. But if we are able to recognize what our stress self looks like versus our best self, we are already on the journey to identifying and making sure that we recognize when and if we're feeling burned out. So here is a great resource that I found, for just that personal check-in that we talked about a couple minutes ago. So it's called the Checklist for Positive Coping Behaviors. And these are just some questions that you can ask yourself to check in and see if the ways that you are coping are actually, positive ways that are helping you manage any stress or negative emotions you may be feeling. So, some of these questions include: are you regularly seeking case consultation with another professional? Do you feel renewed and energized by working with your clients? Do you have leisure activities that you like to do? So realize each of these questions that are being asked speak to a bigger, positive coping skill and a positive way of helping you manage everything that's coming at you during these time periods.
So at this time, I just want to acknowledge the funding that made this webinar possible today and to express sincere gratitude to Alicia for the presentation and so much valuable information. And, the reminder that Being trauma informed and person centered also includes those folks that are, working as counselors, working as advocates, human service professionals to support survivors of sexual violence and other forms of trauma. So thank you very much, Alicia, for so much valuable and important information. I also want to thank all of you for joining us today for this webinar, and again, acknowledge our funders. If you need any additional information, I'm going to be showing the slides for all the different references and resources that Alicia used to compile this presentation today, but also always feel free to reach out to pcar.org for additional information.